Hello everyone and welcome back to the Awesome Physio YouTube channel. Today we're going to be kicking off our mini series on pregnancy related conditions and our top exercises to help women during pregnancy and after. So the first video we're going to be looking at today is why is someone getting back pain during their pregnancy? So pregnancy related lower back pain or peripartum posterior pelvic pain is really common when women get into their 5th or 6th months of pregnancy. So as we're going through each trimester, typically going into 3rd trimester, as the body is changing and getting nearing the end of pregnancy, it's really common for approximately between 60 to 70% of pregnant women to experience some sort of lower back pain during pregnancy. So when I'm thinking of the triggers and the most common causes for this and why the back pain comes on, I typically break it down into 2 categories. Category 1 is all about laxity. So as we're going through the pregnancy in each trimester, the body has to accommodate to be able to give birth to the child. And so one of the key things that happens is the surrounding ligaments supporting the lower back and other ligaments of the body typically soften and become more lax. So collagen structures become softer. What this means, however, is if you're either already a little bit mobile or that you're finding as you're going through, that laxity can start to cause tenderness and pain. So if we're thinking about the laxity through the ligaments, we typically have the ligament flavum, the anterior and posterior longitudinal ligaments, as well as interspinous ligaments. So all these words mean around the lower back, they blend between the joints and the discs and they help support the lower spine. If they've suddenly become more laxed, this can put additional pressure on your facet joints, which are the joints that help with rotation, and can also mean that the woman is less likely to be able to hold herself up as comfortably, which can trigger pain and soreness. In addition to this, what our abdominal muscles, our core muscles, our corset of support have to become more lax to accommodate during pregnancy. So you think where you would normally have that lovely corset of support with the deep core muscles, as well as the pelvic floor, and then the support of the erector spinae around the back, suddenly all of that becomes more laxed and you can start to feel tenderness because again you're putting more pressure through different structures and overall can feel a lot less stable into that lower back. And obviously as the uterus is expanding, as it's growing and we're changing the center of gravity, shifting it forward, that laxity where it's built up is then going to struggle or find it a lot more limiting to hold the woman in that position, which is why that dull ache can form into the lower back and around the surrounding joints and structures. Part 2 is all about the body mechanics. It's excessive pressure through the body. So as we know, as we're going through pregnancy, the natural mechanics of the body changes. So in our lower back, we always typically have with the anatomy a lordotic curve, so an extension curve of the lower back. What happens, however, as the center of gravity is shifting forward, is typically we get a hyperlordotic curve. So the curve of the lower back becomes a lot more extended. If you've had any previous history of issues into the lower back, or potentially you've had a dull ache or soreness from there before, if you were an office worker or any kind of work that was repetitive, that fatigued or made that area really, really sore, if you're suddenly going from here to a hyperlordotic curve, that can intensify symptoms that might be already there. But also that increased lordosis puts more pressure through the discs and the facet joints. That then coupled with the laxity can make the area quite unstable. And so what our body does to try and compensate is it tightens around the area, so it tries to tighten your lumbar erector spinae muscles, so the deep muscles around the back, and your QL muscles between your 12th rib and your pelvis to try and fix you in that position. So it's very common as women are going through pregnancy that they can get that dull ache into the lower back. So what is the typical clinical presentation that we would see in clinic? So obviously someone coming in their 3rd trimester, pushing and palpating around the lower back and the SI joints and all of the pelvic joints around that area and all of the surrounding muscles, so your glutes are probably going to be a little bit tender and a little bit tight. What you would also find is on certain transitional movements, so for example, a Pregnant women might say from getting from seated to standing, or standing for long periods of time, or sitting for long periods of time. This can feel really, really sore, and it's almost like a dull ache, quite generalised into that lower back. If it's the deep postural muscles that have fatigued, they might find if there's specific pain into one of the facet joints, so the joints that move the lower back, it might be a lot more one-sided, but also referring where it gets worse on certain movements. They might say, when I twist over to the right, that triggers my pain even more. So it's very, very specific. Same with walking and that transitional movement. If we've laxed or causing pain around the capsule or the ligaments of the SI joint, the joint at the back of the pelvis, that seated to standing or that walking movement can cause tenderness through that area. So what's really important, if you're off to see one of your musculoskeletal experts, whether that's an osteopath, physiotherapist, chiropractor, what they would look at as you're going through pregnancy is ways through potentially using conservative treatment to help get you moving and make it a lot more comfortable. So we'd want to know which structures are sore and involved during the pregnancy. Could it be impacted by your past history, i.e. was there an injury there before that has suddenly been aggravated during pregnancy? Anything that we can help in terms of release and movement, anything that might need additional exercises to stabilise through there, and any advice that we might look at day to day in terms of best sleeping position, how to move, support, that might be really beneficial.